Now with PKD, there's some physical symptoms like the pains or you see blood or infection, and those are not very, very common. The most common is the high blood pressure. Almost everybody is going to have high blood pressure as the kidney disease is advancing. It's very important that high blood pressure is well treated, because most of the times if your blood pressure is in the 140s, 150s, you might not have any symptoms. But we understand with the decades of studies that high blood pressure can reduce the kidney function and then get to kidney failure earlier. So it's important to treat that high blood pressure.
When our patients have uncontrolled blood pressures and they come into the office, the first thing that I want to check is to make sure that they're checking their blood pressures at home and they're compliant with their medications. After that, we review what is the appropriate way to obtain a blood pressure. Once they have their blood pressure log, I have them to bring them into the office so that I can review them and we can make necessary changes with the medication if needed.
We want to do the lifestyle modifications. We want to lose the weight because that can help also with the high blood pressure. We want to reduce the high salt in the food, which is hidden. So it's important to have kind of a pause, look at your diet, and then over kind of 10 days or 2 weeks, figure out how much sodium or salt you're having on a daily basis.
As I age with this, I'm checking my levels to stay on top of it, right? So nothing gets too far. Really, the bigger things are not so much the disease, but the side effects, like the cholesterol, blood pressure, same thing. It's just those are the ancillary things that I really am aggressively managing.
Now with PKD, as the kidneys are growing, even when they're not very enlarged, there could be an acute pain, which is bleeding, infection, stones, or some other type of pains that are caused by other organs. So it's important not to just say this is all PKD. So that's the acute part. Now there's chronic pain, which is the more difficult one because you have to live with this chronic pain on a daily basis almost. So these chronic pains could be related to the enlarged kidney cysts. And these kidneys are very heavy. They can add more weight and more burden and more stress and strain on these muscles of the back. And this way, these can cause the chronic flank pain, back pain, can cause also some abdominal pain in the front.
The most common problems, they are very big, and that causes all kinds of symptoms, back pain, they cannot bend and tie their shoes. It's like being pregnant, basically. But also, sometimes the kidneys are not that big, but they're infected.
Most ADPKD patients have chronic underlying pain that they will describe either as dull pain or sort of a fullness. And what we're looking for is a change in the quality of that pain. So if the pain all of a sudden becomes sharp, or it becomes stabbing, or it somehow changes in character, that change in character can often tell us that there's something going on within a cyst, either cyst rupture, cyst infection, or bleeding into a cyst.
In college, kind of the flank pain, I was a college volleyball player. During certain times of the season or just like strenuous practices or games, like I would just start to have this like flank pain at the end of them. And then just like frequent UTIs or kidney infections, having those and then learning how to manage those better have kind of been part of it, but also dealing with kind of the growing kidneys and the pain that comes with it. It's kind of just knowing my limits and then kind of adjusting where I need to.
So with chronic pain, it's important to understand that it's rare to completely cure chronic pain. It's important to also understand that we believe that the PKD can cause pain, and it needs a multidisciplinary team to make it more livable or more tolerated. So we want to do everything possible to help you with your chronic pain. That involves kind of multiple layers, so there's not like one magical solution that fixes everything. We start by looking at how big the kidneys are. And if there's very large kidney cysts, few large cysts in each kidney or in the liver, there are some interventions that could be done to reduce the volumes. So then instead of having a big kidney, it becomes a little bit smaller, so at least it takes the edge off.
As the cysts are increasing, they're putting increased stretch on the capsule of the kidney, and we think that's where most of the pain sensation is coming from. So sometimes when we're thinking about how to manage pain, we'll start simply. So if doing regular exercise helps manage that pain, or doing other kinds of therapy, massage or rest or relaxation kinds of therapies helps with that pain.
There's also, if they are eligible for tolvaptan, we know that tolvaptan can shrink in the beginning the kidneys and can help in 30% of patients their pain to be more tolerable. So it's important to kind of consider that too. Now with PKD, cyst bleeding is one big thing. It doesn't happen all the time, but it is frequent and common, where you could have an acute pain in the flank or in the abdomen. It could be the cyst having a blood inside it. Now many times it's contained, you don't see the blood in the urine, and it kind of goes away within a day or several days, and you just rest and hydrate, and it usually resolves on its own. The other thing that the complication unique to PKD is these cysts can get infected. Also, thankfully, it's not very common, but when it happens, it's important to treat it differently, which means we need particular type of antibiotics, and we need a longer period of treatment with antibiotics. So it's important to not brush it off as just like a bladder infection or just a regular kidney infection, but try to make the right diagnosis and figure out if this is really a cyst infection or just a regular kidney infection or a regular cystitis or bladder infection.